The pressure is now on Senate Republicans, who took a big step this week in their effort to repeal and replace Obamacare. But does that health care plan have the votes to pass? Joining us to discuss it, from Springfield, Illinois, the Senate's #2 Democrat, Dick Durbin. And here in Washington, Wyoming Senator Dr. John Barrasso, who helped craft the plan. First to you, Senator Durbin. Let me pick up where Secretary Price left off. Is there a single Democratic senator that you can identify who might vote for this plan?
No, not as written. And I will tell you two things that were omitted from your interview with Secretary Price. I asked him 10 days ago in a hearing before a committee, have you seen the Republican plan? Are you part of the discussion? He said, no, I haven't seen it at all. This is a man responsible for implementing it. So we are going to vote this week on changing the health care system in America without any public hearings, without the publication of a bill, without any discussion, debate. And then we have this expedited amendment process. It is really disgraceful to think that the Senate has reached this point.
I understand your procedural objections to the bill, but let's talk a little bit about what's in the measure, in the plan, as it was announced this week, to the tune of, what, 142 pages or something. What would it take, in your judgment, to get some Democrats to come over and vote for this plan?
Take repeal off the table. And the other thing that wasn't mentioned in the earlier interview, what's driving this is not health care reform. What's driving this is a tax cut. A tax cut the Republicans insist on of about $700 billion for the wealthiest people in America and pharmaceutical companies. That is what the Republicans had to put in the plan to make it work for Republicans, and then they took the money out of health care, out of Medicaid. And that's why we see 23 million Americans losing their health insurance. It's so those at the highest income categories can get a tax break. Take that off the table. Let's talk about repairing Affordable Care Act as it exists.
Senator Barrasso, let me bring you in here. What do you say to Senator Durbin's objections that this is basically not really health care reform or Obamacare repeal and replace, that this is a big tax cut for rich people?
Well, it's absolutely wrong. The crisis is getting worse. Obamacare is collapsing every day. I was at a hospital yesterday in Casper, Wyoming, talking to doctors, nurses, and patients. There is an urgency to act. We are down to one company providing insurance in Wyoming. The prices have skyrocketed. That's why we have to do something. And we need to do what the people are asking for, which is stabilize the insurance markets. Senator Durbin doesn't want to talk about the fact that in Illinois, they're way down the number of people even selling insurance, and prices are way up. That we want to eliminate the mandates that you have to buy a government-approved product, get rid of all of the taxes, but focus on the fact that this is about health care for people who, many people in Wyoming, lost it under Obamacare. They had insurance they liked and they could afford. The Democrats said, not good enough for us. It was good enough for them, and they could afford it.
Well, let me press you a little bit on Senator Durbin's point, which is that you repeal all the taxes that are in here. Tax cuts naturally, benefits tend to graduate to the people who pay more taxes, which is, of course, the more wealthy people. And that on the other side of this, over time, Medicaid funding will diminish. And therefore, the argument is made, this is repealing and replacing Obamacare on the backs of the poor. What do you say to that argument?
Obamacare raised taxes on every American who uses health care in America. They put it on over-the-counter medicines, prescription medicines, medical devices, which are so often used for the disabled population the most. And so it's been very cruel taxing on Obamacare. But that's what he wants to talk about. We want to eliminate all of them. They put taxes on people that buy health insurance. So anybody using the health insurance, the cost of that has actually gone up by the taxes under Obamacare. With regard to Medicaid, I'm a doctor who took care of every Medicaid patient that there was that came to me in Casper, Wyoming. As a state legislator, I always believed we could do a much better job if we could just have control of that money and actually help more people with the same amount of money without all the Washington
You mean local
mandates.
control?
Local control, which is what I saw in the Wyoming State Senate. But the amount of dollars going to Medicaid from today on out continues to go up year after year after year. So when Senator Durbin refers to a cut, only in Washington is giving more each year, something it could see a cut if it doesn't go up as fast as he would like it to go up.
It goes
up every year.
Let me turn back to you, Senator Durbin. There is a question about the growth in Medicaid spending and the fact that our budget problems are driven in huge part by the kind of entitlement program that Medicaid represents. And with its exponential growth, aren't we in a situation where something has to be done to curb the growth of Medicaid and perhaps other entitlement programs?
Brett, let me tell you, my friend John Barrasso, and he is my friend, spends a lot of time, we talk about Wyoming. Over the weekend, the head of the Wyoming Hospital Association came out against Senator Barrasso's bill, and the CEO of the Wyoming Medical Center said it's going to hurt everybody in Wyoming. Now, that's what's being said in his home state as he
She
tours
also
these
said
hospitals.
she didn't read the
Let
bill.
me say a word.
She also said she didn't read the bill. So she could read it
well,
first.
because it's impossible to find, you couldn't find the bill until the very last
only
minute.
150 pages.
Most of it is tax cuts.
Senator,
but I want to say,
let me get back to my question
if I could
about...
respond on Medicaid.
Yeah, go ahead.
May I please?
Sure.
And I might say that the Republican governor of Wyoming would like to expand Medicaid, but the legislature won't let him. And the reason we need to expand it is to make sure that people who are currently working hard in low-paying jobs and have no medical benefits have an opportunity through Medicaid to have insurance for their families. Why do we have this increase, this dramatic increase in people on Medicaid? Because so many people are working hard every single day and don't have health insurance. Medicaid is their ticket to health insurance. And the Republicans have decided to put a cap on the amount of money that's going to be given to states, and Republican governors like the governor of Nevada, the governor of Ohio, the governor of Illinois have said this is a disaster for our states if you do it.
Senator, nowhere though in your answer in your comments do I hear an answer to the question of, is not Medicaid expanding at an unsustainable rate, and does not something have to be done for budgetary reasons, long-term and short, to curb the growth of this program and others like it?
Brett, let me tell you what is expanding at an unsustainable rate, and that is the notion that people would not have health insurance under this Republican approach. Let's face the reality. Even if you don't have Medicaid, even if the Republicans are successful in cutting back on it, people get sick and go to the hospital. In a state like Kentucky, one of the largest expanses of Medicaid, if they eliminate the Medicaid funding, it'll be a 165% increase in Kentucky in uncompensated care. There's going to be medical care given to these people, the working poor and those who are struggling, and others will have to pay for it. The Republicans won't face that reality.
Senator Barrasso?
Well, Medicaid was set up for poor women, for children, and for people with disability. Obamacare used Medicaid as a dumping ground for able-bodied, working-aged individuals. There are ways to modify Medicaid. Mike Pence, vice president, when he was governor of Indiana, did a wonderful job of that with the local control that we are asking for all across the country. But the growth will continue for Medicaid. We need to do it in a responsible way. But to just talk about these things as being cuts, it's just not the case. And when they dumped all of these additional people onto Medicaid, it made it that much harder for the poor women, children, and people with disabilities to get the treatment they need, because now more and more doctors are saying, actually a third of doctors say, I just can't see any new Medicaid patients. So Obamacare actually made it worse for patients who were originally designed to be helped by Medicaid.
Senator Durbin?
I can tell you that this approach, the Republican approach, will devastate Medicaid. And you know who will be hurt? Rural hospitals in Wyoming and in Illinois. Ask your hospital association, Senator. My hospital association put out a statement over the weekend here in Illinois and said, this is devastating. We're going to lose jobs in rural hospitals in Illinois. That's the Trump constituency that's going to be hurt by this approach on the Republican side. And secondly, we're going to see premiums go up dramatically, particularly those
But they're
between
going
the
up
ages of
dramatically
50
now,
and
aren't they,
64.
Senator? Aren't they going up dramatically now?
They're going up, but they're going up now, but I can tell you it is a finite group of individual insurance marketplace people, 5 to 6% of the overall market. That's what we need to sit down and fix. Democrats and Republicans should work together to make the Affordable Care Act work for them, not devastate Medicaid, not raise premiums.
Senator Barrasso?
Senator Durbin has no interest in working with the Republicans on this, but he should have seen the headline in the Chicago newspaper that said Obamacare rates a rate shock, another Obamacare rate shock. That's what's happened all across the country.
Yeah.
People are hurt by these incredible increases. This is a program that is collapsing.
Senator Durbin, let me just cite a couple of examples and let you respond to them. I think we have something we can put up on the screen on some of these premium increases. In the state of Maryland, Blue Cross Blue Shield up 52% 2018. And you can see New York, 49% Blue Cross Blue Shield. Cigna in Virginia, 45%. Anthem in Connecticut, 34%. Delaware, Highmark, Blue Cross Blue Shield up 34%. Those are pretty sharp increases, and those are just a sample. Senator, it seems to me that to complain that premiums may go up under this plan, it seems to me they're going up pretty seriously under the present situation, are they not?
The Congressional Budget Office, when they analyzed the House approach, which is similar to the Senate approach as we've seen it, has said that this is a stable insurance market, and there's need, obviously, for us to work in the individual insurance marketplace with 5 or 6% of Americans who go there. But in the meantime, when you go to the insurance company executives and say, why are you pulling out of markets? Why are you raising premiums? They say the uncertainty in Washington since the arrival of President Trump, who from his first executive order has been undermining health insurance and the Affordable Care Act, cutting off the individual marketplace, which would expand insurance pools and bring premiums down, cutting off the assistance for those who need help and paying for premiums. These are the things that are sabotaging and undermining the Affordable Care Act. You can't have it both ways. You can't claim a death spiral while you're choking a system to death.
What about it, Senator Barrasso?
Obamacare has sabotaged the insurance market in the country to the point where now in half of the counties around the country, people are down to either 0, 1, or 2 choices. You have over 40 counties where no one is selling Obamacare insurance.
Senator, you've made the case pretty effectively that Obamacare is in trouble. I think you know, even Senator Durbin would not disagree that something needs to be done. The question now is, of course, whether you and your team of bill designers can find a way to bring over the senators you're going to need. You're down 5. You can only afford to lose 2. There may be others.
I've worked with all of them. Every one of them is committed to a fundamental change away from Obamacare and central government control and into local control and patients making decisions. We're going to continue to work with each of them through the process. Every one of them has very good points that they're making. I want to work with all of them.
Yeah, but do you have the flexibility within the framework of the bill to fix it so that they'll go with you?
I believe we do. I believe we'll get it passed, and that's the only way we can fundamentally change away from Obamacare, get rid of all of the hated mandates and the taxes, and put Medicaid on a sustainable course long-term. Get down the cost of care and insurance.
Senator Barrasso, Senator Durbin, a very good debate. Thanks to both of you. Up next, we'll bring